I'm studying for my MBA. I reviewed We Need to Talk, an observational study of the impact of electronic medical record implementation on hospital communication, written by Stephanie Parks Taylor, Robert Ledford, Victoria Palmer, Erica Abel, and it was published by BMJ Quality and Safety Online first. So this article discussed the impact that electronic medical records had on communication in the healthcare setting between nurses, providers, and patients. I know that at some point each of us is going to encounter electronic medical records, either through as a patient or a provider. So this article highlighted the key areas of communication opportunities when implementing an EMR. They looked at a group of nurses, providers, and patients and surveyed them prior to the implementation of EMR, and then a year later they surveyed them again to look at how communication was impacted in terms of face-to-face communication, length of stay, whether the patient was able to predict their length of stay, and they looked at the pending consults that the providers were putting in for the patients, and then they got a total agreement score to kind of look at where the patient and the nurse kind of fell with agreeing with the provider. What was determined in the study was that overall everything decreased. The ability for face-to-face communication decreased with the implementation of the EMR. Less time was spent with the patient, and the patient ability to determine their stay based on what the provider was telling them on admission also decreased. So this kind of brings some concern surrounding using EMRs and how are they impacting the care that patients are receiving. It was determined that the communication actually worsened for patients and the quality of the care they were getting worsened because they were not fully understanding the care that they were getting. Face-to-face communication plays a huge role in healthcare. The verbal and nonverbal cues that come with face-to-face communication are important, both between providers and providers and patients. There's a lot that's said that's not really said. The ability to communicate in real time is something that's undervalued when you implement the EMR. The asynchronous communication does not allow for clarification like face-to-face does. Previous study was actually done on computerized physician entry orders, showing that after 1 year the negative effects of that went down. However, I think that using the EMR is a much larger undertaking than a single step of entering orders. In conclusion, I think that EMRs have the ability to have a positive impact on our communication in the healthcare setting. I think further studies need to be done to look at the long-term use of it. And I think that based on this study currently that the impact is negative just based on the results that they provided. But I think there's still an opportunity for growth and improved communication with EMRs. So some questions I'd like you guys to consider on this is whether or not you feel like you have ever had if you've ever experienced a poor communication due to EMR. Why do you think that face-to-face communication declined so much due to the EMR between the nurse and the physician? And also, can you identify some risks that could be associated with these findings, both for the nurse and for the provider and also for the patient? Thank you.